Hi guys, I am Richa Sehra and I am from Responsible Hospitals. I am again live for today's session. Today's session is going to be more about UTI. We were initially talking about it, but there was a network issue, and I am going to add the doctor once again. Dr. Ramit is with us, who is HOD Metro Hospital. Going to talk about UTI in a problem where we're going to discuss about the symptoms, the problems, the causes, and when to diagnose it. So all that under one roof. So hi, Dr. Amit. Once again, I welcome you this
Hello,
time.
Richa.
I'm happy to see you.
Yeah. There was a problem with my mobile, so I switched the mobile now, I guess.
Yeah,
So,
that was
videos.
the final idea. So good, we are doing it because otherwise we could have, we were not in a position to reschedule it again. So
Sure.
thanks for your patience as well. Thanks for everyone who has been patiently listening to us. We're going to talk about UTI, and we'll start it again probably with the questions now, since it's now more clear. So, Dr. Amit, do tell us, because a lot of people, they go through with burning sensations, they go through with discomfort, and they do not actually realize when to see a doctor, what is the right time, and what have made them, happen this UTI, whether it is very serious or it is just a normal that they should ignore it. So all these pointers come in the mind. So we'll start with that, the basic question, what UTI is. If you can just put your words on it, that what UTI is exactly. Then I'll take up more questions.
Yeah. So, thanks, Richa, for having me. Yeah. And I would like to, I was actually discussing UTI previously also, so I would like to restart again. So, UTI is a urinary tract infection. So, as the name suggests, it's an infection of the urinary tract. Okay, it is a very, very common and prevalent condition in the society, although very less talked about because of the stigma associated with it. So, the urinary tract is composed of 4 organs, as I mentioned earlier as well: the 2 kidneys, the ureter, the bladder, and the urethra. So, to understand the urinary tract infection, we need to understand what the urinary tract is. So, I explained previously as well that the kidneys, the main function is to produce the urine. In a normal, healthy individual, the kidneys produce around about 1 to 2 liters of urine, depending upon how much fluid he is taking. If he's taking 2 liters of fluid, he should be producing around 2 liters of urine.
Okay.
So the kidneys are, being sized, fist-sized, the size of a fist, organs situated on either side of the spine, underneath the rib cage, and through the kidneys pass the urine. So the urine enters the ureter, which are the thin, muscular, tube-like structures. And from the ureter, the urine enters the bladder. So as I said, the bladder is a hollow, balloon-shaped, trigonal organ, which is situated between the two hip bones in the pelvis. So it's floating in the pelvis. So it is a hollow organ. So as the bladder gets filled with the urine, so it basically sends impulses to the brain, and from the brain, then the impulses come. So when the impulses are sent to the brain, it basically makes us go to the washroom, to the bathroom to pee. All right, so the bladder gets filled with the urine up to a point that it cannot hold much of the urine inside. So normally a bladder can hold up to 2 cups of urine, not more than that. Okay. So when the bladder is filled with that much amount of the urine, there will be impulses which will be, sent to the brain, and from the brain, the impulses again come back to the bladder, and from the bladder, the lower end of the bladder, which is called the neck of the bladder, urethra is attached. Okay, the urethra is also a tube-like narrow structure, which the main function of it is to the passage of the urine, so that the urine is passed out or flushed out. So any infection or any problem in either of the 4 structures, the kidney, the ureter, the bladder, or the urethra, will manifest as symptoms and lead to a urinary tract infection. So you asked me, the patient will present with burning sensation, will present with difficulty passing urine. So these are all symptoms of lower urinary tract infection. So as I said, there is an upper urinary tract and there is also a lower urinary tract. Okay. So what is an upper urinary tract? So upper urinary tract consists of the kidneys, the 2 kidneys, and the ureter, whereas the lower urinary tract consists of the bladder and the urethra. Mostly the females. So why the females are more predominant, or they're more susceptible in catching urinary tract infections, is Simply
True.
because of the fact, and why I discussed the anatomy of the urinary tract is very important, that the urethra in the females is very short. It's shorter in length. So
Okay.
because of the shorter length of the urethra, the females tend to catch the urinary tract infection more frequently. So and so that 1 in every 2 females during their lifetime will have urinary tract infection, and 1 in every 3rd female by the age of 24 years, okay, will have this infection, urinary tract infection.
Okay.
And the males, on the other hand, the males, their ratio or the incidence in them is very less. By far, it is very less. So compared to the men, it's 8:1. So for 8 men, for 8 females, only one man catches the urinary tract infection.
True.
Simply because of the fact that the urethra in the females is very short.
Okay.
And so the manifestations, the symptoms, they vary. They are different. They're different for an upper infection. They're different in a lower infection. For an upper infection, the patient will present with a more advanced infection. Patient will have a complicated infection, complicated UTI. So the patient can present with a high-grade fever associated with shivering, chills, rigors. Patient can have nausea, vomiting. Okay, they can have a lower flank pain in the right, left or right, side of the abdomen. On examination, if you examine the patient, you touch the ribs of the patient, either side of the rib, they will have tenderness there. So that is important. So this symptom is classical of infection in the kidneys or the ureter. Okay, so this is called as acute pyelonephritis. This is acute pyelonephritis. But if a patient presents with the symptoms, as you said, like burning, there can be burning sensation in the urine, there is difficulty passing urine, there can be leakage in the urine, which is called as urinary incontinence, or there can be blood in the urine, which is called hematuria. Patient can have lower urinary tract infections. Okay, so the lower urinary tract infections are usually in the bladder, or it can be in the urethra. If the infection is confined to the bladder, okay, if it is confined to the bladder, it is called cystitis. One very important presentation or a diagnosis goes by the name of honeymoon cystitis. So couples who go on a honeymoon, when they come back, especially the females, the newlyweds, they present, the typical symptoms are burning urination, dysuria, they have difficulty passing urine. So they have given the name as honeymoon cystitis. The cystitis is the infection in the bladder. Okay, so that is very common in the females. So, and in the urethra, there will be another presentation. The patient can present with a discharge, which is not common in the bladder infections. It's more common in the urethra infection. So if we see the type of symptom the patient presents to the doctor, he can assess that the patient can have an upper infection or it can have a lower infection. So that is the important thing that I wanted to discuss.
Sure. Great information, doctor, because a lot of things we are not ourselves aware, and laymen would not even know all this. So I think I would like to know, how is it different? How is it different when you talk about males and females? You have just mentioned about, there's a ratio is 8:1. So when a person realizes that now this is UTI, this is a problem, and I need to see a doctor, when is the right time when they realize that it is required to go to a doctor now?
So it all depends upon the presentation of the patient. What are the classical symptoms? What are the findings? Okay. So as I said, if the patient has burning urination, he or she is having difficulty passing urine, there is an urgency to pass the urine, there is a hesitancy to pass the urine, and the patient is frequently going to the loo, to the washroom to pee. These are all classical indicators that the patient is harboring some infection inside. And the most common organism, the cause which causes the infection, both in the males, see, there is no separate findings in the males or the females. The presentation is the same. Both the males can also have the same findings as the females. Okay. The only thing is that it is more common in the females because of the fact of the shorter urethra. And the commonest organism which causes this infection is a bacteria. That is, in 80% of the cases, is an E. coli bacteria. So if you do a culture sensitivity test, urine culture sensitivity test, you will find most of the times it is the E. coli bacteria. In some instances, it can be a fungus also. In rare cases, it can be a fungus, but most commonly, they are the bacteria that cause the urinary tract infections. So if you take a proper treatment, at the proper stage and at the proper time, and for a proper duration, then you will be getting rid of the infection.
Okay. So sure, doctor, I'm going to ask very basic questions. Let's say a female, there are a lot of females, they usually pass urine most of the times in the night time. I don't know if it is correct or it is bad or there is a problem or it is just generic thing. So going to washroom in the middle of night, during you are sleeping. So is it related to UTI, first of all?
So this is not a symptom. This is not related to a UTI, but the important thing in the prevention of UTI, if you ask me the prevention, how do you prevent and what are the measures?
Yeah.
See, we discuss that. Okay. So the thing is that the first and most important point is you have to have plenty of fluids. Drink plenty of fluids. Okay. And in the fluids, your half of it or more than half of it should be water. Okay, so if you're taking any fluid, you're taking juices, you're taking soups, you're taking anything, it should be more than half of it. At least 6 to 8 ounces of glasses of water should be recommended. And this demand, it basically gets increased in cases of kidney stones, in cases of bladder stones. So you have to increase the amount of water intake. But
Right.
special word of caution for patients who are chronic kidney disease patients, who are heart failure patients, they should not be taking that much of fluid. So the fluid intake should be limited in such patients. Secondly, very important point to be mentioned here is that you have to maintain a very good bladder and bowel health. What do you mean by bowel health is you should not be feeling constipated, you should not be feeling bloated. In simple layman terms, you should not be having diarrhea too frequently. Okay, so how do you maintain a proper bowel health? Just give you some tips to it. Firstly, you should eat right food. So how do you select what is the right food for a good bowel health? Okay, so for a good bowel health, you should be eating foods which are rich in lean proteins. Okay, should be rich in nuts. Should be rich in nuts and colorful berries like blueberries and the raspberries. You should be having a lot of diet which is rich in this, and lots of fruits and green leafy vegetables. Secondly, you should lead a very healthy lifestyle. So it's easier said than done, leading a healthy lifestyle. Okay, so what do you mean by a healthy lifestyle is doing regular physical activity. So one who is having a sedentary lifestyle, who is in a doing an 8-hour office work, having a sedentary lifestyle. So for those people, they should be, after every 30 to 35 minutes, should be getting up from the chair, and doing some stretching and all, so that there is appropriate blood circulation going on throughout their body. Secondly,
Right.
avoid, alcohol intake should be moderated. Quit smoking if you are doing that, and limit on your caffeinated drinks and foods. Okay, so the caffeinated drinks and the beverages, especially tea and coffee, are also known to cause, should be avoided in cases of patients who are having recurrent UTI. We'll get to that if we are discussing recurrent UTI. And thirdly, as you said, people, so see, we are living in a gadget era, the thing. So what we consider is that urination is not that important. So people don't actually feel the need to completely evacuate the bladder.
Yeah.
Okay, so they are in a hurry most of the times, and what they do is, if they are somewhere out, they will try to hold their urine. That is absolutely not recommended. If you are trying to hold your urine and say that I will urinate after some time, after an hour or so, what happens is the bladder which is holding your urine, the muscles which line the bladder, eventually they become weak. Okay, so what happens is, when they become weak, they become lax, and then you go to the washroom, and you in a hurry, you don't completely evacuate your bladder. There is some residual urine which is left inside your bladder.
Okay.
So to understand this, for example, we have a rainy season going on, the monsoon season. A lot of dengue patients are coming. So
Right.
how does dengue occur? It occurs through the bite of a mosquito, right? And how do mosquitoes breed? They breed in a stagnant water. Similarly, in this case, if in the bladder there is some amount of urine which is left inside the bladder, it becomes a breeding ground for bacteria. So the bacteria, they grow inside the bladder and they cause all the symptoms of the urinary tract infection. So never be in a hurry to, incompletely evacuate your bladder. Always completely evacuate your bladder and never hold your urine for far too long. So that is another
Absolutely.
important point.
Because you have said it very correctly. This is the, whenever you are in hurry, you actually avoid this part. You feel like,
Yes.
okay, it's just a normal thing. As long as you do not catch the infection, you do not actually realize the seriousness of that. So I got your point. I think that's a right message which you have given. Let's talk about how, since you just mentioned it, that first step is in case uh, somebody gets the UTI, then how do they cure it, and what is the steps they need to follow it?
Okay. So as we progress, if a patient has, developed all the symptoms of a classical UTI, now first we have to see whether it is a complicated UTI or it is an uncomplicated UTI. Okay, we have to first define what type of UTI is it. So if it is an uncomplicated UTI, like most of the individuals, in such cases, what happens is they are usually healthy individuals, normal healthy individuals who don't have any underlying medical conditions. Okay, they would not be having any diabetes, nor hypertension, nor kidney problems. They're healthy individuals, and in them there will be classical signs of burning urination. There will be, hematuria will be there. There will be difficulty passing urine. So that is an uncomplicated UTI. If a patient gets these symptoms of an uncomplicated UTI, the first thing is to consult a doctor. You can consult a general physician. You can consult a
Yeah,
urologist.
because
Okay.
that was my question, that whether they can consult with the general
Yeah.
physician or they need to see a specialist.
So for that, so see, that is the thing where the picture comes. If a patient of an uncomplicated UTI, he develops the symptoms of the UTI, he can consult a general physician. Okay, the general physician or the doctor will examine him, take the history, do certain investigations, and confirm it on the culture and sensitivity test, urine culture and sensitivity test. After diagnosing it, he will be started on an empirical antibiotic treatment, which lasts for a week or two. After completing the antibiotic therapy and also certain dietary modifications and a lot of fluid intake, this should cure the patient of an uncomplicated UTI within 2 weeks. If the patient is not getting cured even after 2 weeks, then there are different causes of the UTI. Okay.
Okay.
So what we then say, there's a condition called as chronic UTI or recurrent UTI. Okay, so what is a recurrent UTI then is, so the patient having 3 or more than 3 episodes of the same urinary tract infection in a period of 1 year. Okay, so the patient has had 4 episodes, say about 5 episodes of the urinary tract infection, becomes a recurrent UTI. Now the recurrent UTI can be either a reinfection or it can be a persistent infection. Okay.
Okay.
So the persistent infection would be caused by the same bacteria of the same strain, okay, after a 2-week antibiotic sensitive treatment. That is a persistent recurrent infection. But in a reinfection, it could be from a different strain, it could be from a same strain, or it could be, there could be a sterile culture in between the same time period. So these are two different things. So we have to basically understand what are the symptoms and signs of the patient, what is the category of the patient. Is it a complicated UTI, is it an uncomplicated UTI, is a recurrent UTI, is a persistent UTI. The complicated UTI, in that the patient will have structural abnormalities in the kidney, and there will be functional abnormalities. For that, there will be different investigations. The doctor could advise, especially in the postmenopausal women, who have had their menopause, attained their menopause, the urologist or the doctor can advise you for a test called as uroflowmetry. Uroflowmetry is a test to diagnose any structural abnormality in an elderly patient, especially can be done in a postmenopausal woman. So these tests can be done in certain sets of individuals or patients. Okay. Then to detect the complicated UTI, the complicated UTI is detected by tests like CT scan, MRI, cystoscopy. So these are
Okay.
investigations for a complicated, not for the uncomplicated UTI.
Understood. So, doctor, since you have mentioned about that these are the measurements which are available or they need to follow, depending on the intensity of the UTI infection, I would say. So, I would also would want to know that, after, let's say, they are rid of it and they are now fine, when and how frequently they should see a doctor, or how frequently they should get the test done. If somebody who has just felt once and he got the infection checked and he found that there is an infection and he got the medicines for it and he's now fine. So does it require to get the test done within another 3 months or 6 months?
So see, if the patient is not a chronic UTI patient, if the
Mm-hmm.
patient is not a recurrent UTI patient, then there is not required, the test is not required for the confirmation of the UTI or to detect. But obviously, if the patient is of a chronic UTI or a recurrent UTI, then there are certain treatment regimens which are applied. The doctor may start the patient on a 2 month or a 3 month antibiotic course. Okay, so it depends upon from patient to patient.
Okay.
My motto is prevention is better than cure. If you prevent the
Absolutely.
disease, you don't have to cure the disease. Then if you start at the early stage in the prevention only, so the prevention criteria is very important
Yeah.
for the females especially. I would suggest that whenever they go to the washroom for a bladder or the bowel movement, always clean the genital area from top to bottom. That is very important, because the infection, the chances of getting acquiring the infection, they are very frequent if the hygiene is not maintained in the genital area. So always wipe the genital area from top to bottom after a bowel movement. Secondly, this is very common, the UTIs in the reproductive age group, the females, is very common, who have multiple sexual partners, who have had a sexual intercourse, okay, have different types of intercourse like anal intercourse. In those, the chances of acquiring the UTIs again is very high. So in those patients, if they are having the cause as a sexual intercourse, the UTI, in such patients, after every sexual intercourse, 2 to 3 days of antibiotic course is given.
Okay.
Yes.
Okay.
So you have to find out the cause. If such patients are having
Absolutely.
infection as the sexual intercourse as a cause, so prophylactically after every intercourse they are given a treatment of 2 to 3 days of prophylactic antibiotic dose. So the ideal thing what to do is, in such cases, you have to completely evacuate your bladder after the intercourse is over. Completely evacuate your bladder. So whatever the bacteria, so basically what happens is the males, they harbor the bacteria inside their genital tract. From the males, during the intercourse, the bacteria, they enter the female genital tract, and because of the shorter length of the urethra, the bacteria, they enter the bladder and cause the infection. So evacuating the bladder after the intercourse will help you get rid of the infection. So that is
Sure.
the preventive measure. So completely evacuate your bladder after the intercourse and clean your genital area. Have a safe and follow safe hygienic practices. So that is the preventive aspect
I
of the
think
UTI.
you have said it correctly, because you are right. People do not think on the prevention side. They think on that how to cure it. It's okay. If it has happened, it's okay. It's all right. So they accept the problems these days very often and very simply. And that's a right doctor, and responsible doctor can only say that, these days kids prevention is better than cure.
Obviously.
So that's a great message from you. I have a last question to ask you, that let's say if somebody is going through UTI, recurring UTI, I would say, do you think it can also affect the other organs of the body, and it can also affect, in other way, or you may get another disease because of that? That's what I wanted to know.
So what happens is, if you ask what are the complications, what can lead to from the UTI, what can happen from the UTI, so that's important.
Yeah,
So
exactly. The complications.
so say again, it all depends upon what category of the infection you're harboring inside. If you're having a complicated UTI, you're having an uncomplicated UTI. If you're having a complicated UTI, obviously you're going to have a lot of complications. Okay, you can have kidney problems, you can have heart problems, you can have other problems. As patient can land up into severe infection, can land up into sepsis. Okay, he may require even hospitalization and eventually other IV medication. So the basic point is, you have to identify the symptoms early on, consult your doctor as soon as you find the symptoms, as soon as you know about the symptoms. Don't delay, don't be ashamed of the fact that okay, you're having burning in the urine, you're having trouble passing urine, so it's just a normal thing, it'll just shake it off. It will not shake it off, it will lead to many problems. So you have to consult your doctor, drink plenty of fluid. There is another thing, that what diet you should take. Okay, you can take lot of yogurts. You can have yogurt, probiotic yogurt. You can take spinach, you can take broccoli, you can take as I said, you can take cranberry juice. Even though the cranberry juice is controversial, there is no scientific data to support it, but it has got some pigments, cranberry juice, tannin, that help to reduce the acidity in the urine and eventually cure the infection. But it is not scientifically proved, it's only proven in animal models. So you can have cranberry juice, but cranberry juice, a lot of people, they do take for UTI. One word of caution is that they should not be taking, especially for patients who have heart conditions, who are taking anticoagulants and warfarin. So
No.
patients who are on these medications should not be taking cranberry juice. Other patients who are healthy, normal individuals can take cranberry juice, yogurt, and broccoli, spinach, and all. These are all dietary modifications that should be done.
Sure. I think that was the main point. Should be known. So great. I think Dr. Amit, do you have anything else which I have missed out, or something which anybody else, our audience should know more about UTI? Because I think we have covered the symptoms, the causes, the diet for it, and when to see
Yes,
a
I guess
doctor.
we have covered
So,
most of all.
yeah.
Most of it we have covered.
Yeah. So any other point any message would you like to give to all the people, all the females
Yeah,
and
yeah,
men?
yeah. My message is simple. It is as simple as this: prevention is better than cure. As soon as you are, aware of the symptoms, don't be ashamed to go to your doctor, visit your nearest doctor, and get the right consultation.
Sure. Awesome. I had a great session, though initially it went
There were little
little
hiccups.
bit, there was network issue, but then it went really nice. And I think I would really like to thank you that you have given your time on this topic, because this was something, the moment I got to know and our team got to know, they got very excited. We haven't covered this UTI part, and this is very frequent these days and very important to understand more about it. So thank you so much, Dr. Ramit, for your
Thank you,
time.
Rich.
It was great interacting with you. Bye-bye.
Thank you. See you.
Thank you.